Okay, fibroids, what are they? Fibroids are also known as uterine fibroids or uterine myomas. They are fibrous, smooth muscle and connective tissue tumors that grow in and around the wall of the uterus in women. Primarily women in their childbearing years, but particularly women in their 30s and 40s. These tumors are almost always benign, meaning that they are non-cancerous. Many regard it, including myself, as a public health crisis, as over 70% of women experience them by the age of 50. Generally, over time, fibroids shrink after the onset of menopause, but most women experience them at some point in their lives. A fibroid can be as small as the size of a pea, or a few millimeters, or it could be as large as a watermelon. So what is the cause? What causes fibroids? The unfortunate thing here is that there is no consensus as to what the cause is. It's not generally known. But there is consensus in that it has to do most likely with hormonal imbalances, specifically estrogen dominance. What does estrogen dominance mean? It means that you are producing more estrogen than you really need, and it's out of balance. Some women are more susceptible to it than others. So who? What women? Research has indicated that early puberty, genetics, obesity, poor diet, high stress, and being a woman of African descent seems to increase your chances of developing fibroids. I have another presentation on fibroids and its effect on African American women, Afro-Caribbean women, etc. So what are the dangers of fibroids? Women experiencing fibroids often have significant and sometimes debilitating pain, especially in the abdomen and lower back area. Urinary tract and bladder function issues, such as difficulty urinating and pain while urinating, can also occur. Menstruation is often very painful and menstrual bleeding is excessive. It's not uncommon for the bleeding to be constant, day after day after day. Such blood loss can lead to a woman falling into an anemic condition. Anemia is not a pleasant situation and can include general bodily weakness, breathing problems, cognitive dysfunction, in other words, being unable to think properly, heart issues, ranging from rapid heartbeat, but excessive heartbeat and cardiac arrest is also possible. Women experiencing fibroids may also have difficulties getting pregnant and also have very complicated pregnancies. So what can help? We've talked about the dangers. What can help? There are some pharmaceutical drugs and various surgeries that can be used to combat fibroids. You should speak to your doctor about these. That's not the focus of this presentation here. Nutritionally, some studies have shown that vitamin D and green tea may be helpful in shrinking fibroids. The best form of vitamin D is from the sun, but it can also be attained through supplementation if you are in a region with very little sunlight or you are of a darker complexion. Fruits, leafy green, and cruciferous vegetables are also important to the diet when it comes to shrinking or otherwise combating fibroids. The types of leafy greens and cruciferous vegetables you want may include kale, spinach, broccoli, Brussels sprouts, etc. Onions and garlic have significant antioxidant and anti-inflammatory properties, which may help in combating fibroids. Non-gluten grains, beans, and omega-3 fatty acids are also essential in helping to remove estrogen, are anti-inflammatory or otherwise good at combating fibroids. Other non-nutritional activities, such as physical therapy, colon hydrotherapy, and acupuncture may also help. Exercising and staying mentally positive helps to minimize weight and reduce stress. There are a variety of herbs that have been shown to be effective. I don't want to go into them now. I would suggest that you speak to your healthcare practitioner, consult a herbalist, an osteopathic doctor, or a naturopathic doctor. I might have another presentation on herbs and fibroids at a later time. So if these things can help, what can hurt? Well, the number one thing would be stress. Stress causes the release of cortisol, which contributes to fat retention. High levels of fat are shown to contribute to fibroids. It's also important to avoid exacerbating and adding estrogen to your system. So avoid foods with added hormones. Many meats and dairy include added hormones. So it's best to find those that are raised naturally without the use of hormones, or adopt a whole foods plant-based diet. Also avoid refined sugars, not just table sugar, but particularly sugars found in cakes, pastas, breads, and other baked goods. Also be sure to avoid xenoestrogens. Xenoestrogens are man-made or environmental chemicals and products that mimic estrogens. It all still raises the levels of estrogen in your body. Some of the more well-known xenoestrogens are BPAs, which are found in plastic, many beauty products, many hair products. They also include xenoestrogens. So in final conclusion, my friends, I would say fibroids is a tremendous health crisis. It can devastate the lives of women and their families, spouses, significant others, etc. There's no guaranteed solution. And the best way to help yourself is to live a nice, clean dietary life, exercise, de-stress, and always educate yourself.